go on to the next presentation. I will give the floor now to my colleague from Georgia, Mr. Shota CHILINDRISHVILI. And if there are any questions, I will kindly ask perhaps to address them later in order to expedite a little the schedule. Shota, my friend, the floor is yours, and I will give you control.
Hello, everyone. I'm glad to present here on this meeting, and I want to thank, first of all, our chairman with the great work he always does with the planning and implementing our meeting. And I want to thank our host nation, Italy, and all the presenters, because it was very interesting to listen the problems and the main points of the other nations against this huge problem. I hope this is the last time we are meeting online, and our next meeting of IMIHO technical group will be held somewhere, maybe in Georgia. Let's see. So I will make small presentation for those guys who are new members of our project. This will be small presentation about military hospital, our COVID situation, and the pandemic situation, you know, all over the country. So, military hospital is named after Georgian Abramishvili. He was our traumatologist, which dies during the August war against Russia in the August 2008, and military hospital was renamed after him in 2013. And this is a multi profile inpatient medical institution. So we provide complex healthcare services to military servicemen, their family members, civilians of the MOD, and of course Georgian civilians, because this is the biggest clinic in the region. So that means before 2018, military hospital is located in Gori, in the middle of Georgia. Before 2018, it was the only military hospital, but then we opened our branch in the western part of Georgia, in Kutaisi. So we have now 2 clinics. All the beds you see here, we are involved and are involved for now in the fight against COVID-19. And we had to change the structure, and we had to make schedules for the people, especially for the first days of March, because there were very strange situation, because new problems and lots of people who want to be checked, and our doctors and even our administrative staff, we are staying at the hospital for 2 weeks, and we were changing or every 2 weeks the new team of the support. So as you see here, even our militaries were involved. We are infecting everything, even cars, outdoors, because in the first days it was we have no experience fighting with this virus and helping with our friends abroad. We were trying to make first steps. So from the 28th of February 2020, military hospital in Gori became closed zone for the infected people. So from the this was the only clinic in the region who were receiving the patients with the COVID-19. So first quarantine was from February to June, and then we opened, and we were able to get other patients. But from July to up to date, we are mixed. We have COVID patients here. Most of our directions are full of COVID patients, but outpatient and some laboratory and surgical department and also some diagnostic departments are open for the civilians and also military servicemen who are healthy for now. What is very important, from April 24th of April, we made some sort of support group for the patients. As you know, almost all patients with lethal cases had some additional disease, and that was the reason why the situation goes wrong. So we made a support group which was headed with Dr. Nino Chumburidze, and in the team there was all direction doctors, and every day, if we have some serious cases of the infected people, the cases go through this support group, and it was the first time in Georgia, so this our case was spread to the other clinics of the COVID-19 in Georgia. So we were some sort of example for them. And what is also very important, during this COVID diagnostic and ongoing preparations, here was the World Health Organization experts, and they checked everything in the hospital, and it was received the highest score in terms of readiness, and Ministry of Health was recommended that to provide, because in these days, for example, in March and April, we have very low number of infected people. So Ministry of Health was recommended to send them directly to the military hospital because it was the best clinic in Georgia for the readiness of the COVID-19. Now I will provide some numbers of the COVID situation in the country. As I already said, in first days of March, and we have very low number. It was about 20, 30, up to 100. So we have first lockdown from March to July. So there was days when even our own traffic was not allowed to enter outside. It was also commanded hour from 10 p.m. to 6 a.m. and it helped very much. So till July, we had about 100 or 200 infected active cases and only several lethal cases. So it was 20 or 28. So the worst thing happened in August, because you know, August is a very hot period and mostly the borders are closed and most Georgians go to the seaside, and most our famous seaside resort is Batumi. So there was a case in the bakery in Batumi. So from this bakery we had hundreds of the infected people. Only one shop, one bakery explodes the situation, and as you see here, after August we have tens, then hundreds, then thousands, and every 2 weeks the number of the infected cases are increasing till 5,000 per day. Can you imagine? We have about population of Georgia is about 4 million, and every day we had about 5,000 infected people. So for now, then we have a second lockdown. We have second lockdown here from the 28th of November till the end of January. And we have a commandant hour from the 9th of p.m. to 6 a.m. And there's no gyms, there's no shops, there's no malls, only pharmacy and food shops. That's all, and no public traffic. And it's helping for now. From 5,000, we're decreasing from 3,000 now for 2,000. And for now, in Georgia, with population about 4 million, we have you see the numbers, 198,000 total cases, 28,000 active cases, and about 1,800 is lethal cases. In Georgia, in the military hospital, we have very few number of the lethal cases. We are proud of it. We have also very few number of the infected medical personnel, like doctors and the nurses. And our doctors, we are working not only here in the military hospital, but in the infantry brigades. We have some cases that we are trying to get lots of PCR tests, because military hospital was the only place in the region where you can get the PCR tests, and our Lugar lab was helping with us because it was a huge number and our lab can't carry this number. So for now, the situation is okay. We are trying to manage it. Fortunately, most cases are now at home, isolated, and we have only few number of the really serious cases, but we are trying to manage them in the ICU, in the other departments of the military hospital. So we hope that to the end of the January, we will go the same number of hundreds maybe, or tens per day, because it was very important. This success was very important for us, because the biggest trouble is for the healthcare system, because doctors are working 24 hours and and can you imagine when also they are infected? You have to put under quarantine all the queues, so it's a huge problem. And now we hope we will solve this to the end of the January. So this is briefly what I want to say to you. Again, thank you for your attention. Thank you, my colleagues. And I hope we will solve this problem together. And this is a very big pleasure for me to share some knowledge and experience. Unfortunately, I'm not a doctor, so my presentation was only numbers and the cases. And our doctors are very, very busy, really. So next time, maybe they will do the better presentation. Thank you again. Chairman, say
yes, thank you, Shota. Again, I would like, in front of everybody, to thank Shota. He has done a lot for the project, and he has tried really hard. We have our hearts in Tbilisi, Georgia.